Myself, Dr. Deepak, work as a junior resident in the Department of Respiratory Medicine, Patna Medical College. As on the occasion of World Asthma Day, that is on 2nd May, we celebrate as an Asthma Day. Regarding the regarding what is asthma as a simply that is called as allergic airway disease, in which that your airways are very much sensitive to some kind of an allergen that is not seen in other people normally. Uh, and uh, the base the cardinal symptom that seen in patient of asthma, that is the patient may presenting as a cough, maybe what may or may not be associated with what sputum productions, and also the cough may be most commonly at the night or in the early morning, associated with what some patient had also have shortness of breath, which is not seen in all the patient but can be seen. Or the patient may manifest as a some audible wheezing can be heard by the patient or by the patient attendant or his or her partners. And also the patient also complaining of chest tightness also. These all are the classical symptoms, but maybe some patient they only presenting as a cough, some patient only presenting the wheeze, okay, and some patient they also presenting as some allergic disorder, like patient presenting with what allergic rhinitis and atopic dermatitis, and also had some family history of that his or her family had some history of what some allergic airway disease, yeah, some had history of atopic dermatitis and allergic rhinitis. So if you have any symptom of which is mentioned before, please consult to their respiratory physicians for proper follow up, because if allergic rhinitis can progress to asthma, and we know that asthma, if once a patient develop asthma, then if it is not treated properly, then it will go into severe asthma, that is your actually the airway become very stiff and that will not undergo variable airflow limitation. Basically asthma is a variable airflow limitation, and the patient had a symptom of episodic, like patient may have some symptom and the patient without treatment the patient also resolve, but later on it becomes very severe and it will not what it will not the patient become very much discomfort later if he or she didn't receive any treatment. So regarding the treatment of the asthma, actually we follow the GINA guideline, that is a body governing body for the bronchial asthma. Okay, the main line of treatment is to decrease the airway hyper responsiveness. That is, we use various steroid, that is inhaled corticosteroids and oral steroid that is seen in case of acute exacerbation that we use. But there are so many modalities of treatment, like if the patient is not responsive to all this medication like bronchodilator, inhaled corticosteroid, then we use some other kind of monoclonal antibody, like we are using omalizumab and other IG modulators. So just care your symptoms to prevent the progression of asthma. Okay, thank you.